In this video, we'll be exploring Walking Doctor's Quick Pick feature seen here. This feature allows doctors fast, accurate prescription of over-the-counter medicines. Every doctor has the experience of having to write down the same medicines over and over again for patients with common ailments such as colds or stomach upset. This frankly is tiring and time-consuming, but not with Walking Doctor's Quick Pick feature. Let's start on the exam page of Diana Wojaja. She is 41 years old, has no known allergies, has a history of dyspepsia and asthma, and presents to the clinic with flu-like symptoms. Indeed, she's had cough and fever for a few days, low-grade temperature of 38.1, and her heart rate is 105. Let's say the doctor wants to prescribe Diana more than the Tylenol recommended by the influenza checklist seen here. One can do this quickly through WD.Quick.Picks. We locate this feature by pressing the Add Medicine button below the checklist search bar, or if the clinician is already using a checklist, by adding the Add Medicine button below the extended checklist. Clicking the Add Medicine button brings the clinician to the drug prescription page seen previously. On the left side of the screen is the option to type in and prescribe medicines individually. On the right side of the screen is the Quick Picks option, which allows the user to prescribe from an array of over-the-counter medicines with a click. The selections are determined by facility leadership and can easily be adjusted or changed. For example, the common medicines of ranitidine and guaifenesin are listed and presumed to be in stock, with the patient receiving 5 days' worth of medicines unless otherwise indicated, as in the case of magnesium hydroxide and Donatol, which are prescribed for 3 days. If a medicine falls out of stock, or the facility wants to, say, prescribe 7 days' worth of medicines, the selections are easily adjusted by the facility. We will explore this adjustment in a separate video. Let's quickly prescribe the patient diphenhydramine, ibuprofen, and over-the-counter cough syrup. Leaving the screen, we see immediately the medicines ordered at the bottom right of the patient medical record. This same list has been sent both to the nurse to keep track of the order and to the pharmacist for filling. Some facilities have a culture whereby individual medicines are mixed and apportioned according to a clinician's practice style. Walking Doctors doesn't recommend this practice, but based on customer feedback does provide this practice feature. To mix medicines, the doctor again enters Quick Picks, but this time selects the mix mode in the upper right-hand corner. Some doctors make their own antacid medicines, for example. Let's mix a common combination of antacid, anesthetic, and motility agent. In the previous screen, we see that these types of medicines, magnesium hydroxide, Donatol, and viscous lidocaine, are given over 3 days. So knowing that each medicine can be given up to 3 times a day, magnesium hydroxide, Donatol, and viscous lidocaine, the physician can write divide mixture into 9 portions. Give 3 times a day as needed. Entering this order, we see the combination presented clearly at the right bottom portion of the screen. The same items with description will be sent to the nurse to keep track of the order and to the pharmacist for filling. This concludes overview of the Walking Doctor's Quick Picks prescription feature.